Healing is the journey that a patient goes on to getting back to hearing their own inner voice. Integrative medicine is all-encompassing. It's body, mind, and soul. It encompasses the disease process, but also understanding the person who has the disease, because each person is absolutely unique. Their experiences, their thought processes, their external environments, their genetic profile. You actually cannot have a one-size-fits-all for everybody.
A big part of being an integrative doctor is being able to teach the patient, give them the information that is required for them to make the decision. In every disease, cold or flus, or when your child is sick, or even cancer.
Patients these days give their power away. We're constantly looking for a doctor to make us better. And they're not used to a doctor sitting and talking to them and asking them how they feel, asking them what they want to do. You can want to heal somebody, but the healing lies with them. And that is why that relationship is so important. It's a sacred relationship.
The majority of the cancer patients that I have still choose to have the chemotherapy or the surgery or the whatever. With allopathic medicine, specifically in the cancer space, what we will do is keep checking to see if it comes back, but you're on your own. Whereas with integrative medicine, we can go, right, now, cancer's out of the way. We know that something in your body has caused this to come up. That's something. What is that something? Is that something still there or not? And if it is, how can we make that something as limited as possible so that that cancer doesn't come back again? And so that you are more whole and well at the end of it.
If you listen to the names of drugs like beta blockers, antihistamine, serotonin uptake inhibitors, the drug is for interfering with a particular biochemical process, and that's what it will do. There's no intelligence there at all. Giving drugs and more drugs in order to treat symptoms may be slowing down the process of disease, but is not reversing the problem, is not making more health. And in fact, the third most common cause of ill health and death is iatrogenic disease, which is doctor-induced diseases. The integrative doctor is looking behind the disease and recognizing that behind the disease is a whole range of dysfunctionalities going on in the body. And if we can improve the dysfunctionalities, then improving function will heal the problem, which is getting rid of the disease. The challenges are to shift your focus from the disease, because the whole of the conventional model is making a diagnosis of disease. And once you've got the diagnosis of disease, then you can follow the particular protocol that has been developed by experts in the field. That is such a powerful story that it's difficult for medical doctors to get out of that mindset. So very often what tends to happen is that doctors who are learning about natural medicines and getting into natural medicines start to use natural medicines to treat disease. And that's not the integrative model. The integrative model is using natural medicines to support health and allowing the body to heal.
I only know caring doctors, and it feels like as much passion and intention as there is to help patients, there's a lack of time worldwide because people are becoming sicker and sicker. Doctors are becoming more and more tired, and doctors are becoming burnt out.
The South African Society of Integrative Medicine, which was actually brought about by Dr. Bernard Brum many years ago, is about making integrative medicine more accessible to people. It is about assisting our doctors in learning in a direction that they want to learn. Because each person is driven by their own calling, there is no one way to teach it. And so we have to make available as many ways as possible so people have access to learn where they need to learn, and to hear stories about how people have miraculously done things that allopathic medicine couldn't do. When you hear that, you are deeply inspired to trust what your intuition has been telling you actually all this time.
To become more mindful in the way that you live as a doctor or a healthcare provider, it becomes easier to see when your patients are not doing that. If you see them as a human being, and if you realize that the interview that you're having with them is sacred, they read that from you, and in that moment they will open up to you more and give you more hints towards their disease process than they may have if you were harassed and writing and not connecting with them.
We need to recognize that we're dealing with an astonishing amount of complexity. So the question then becomes, how can we make contact with the complexity of the human being? My energy field extends towards the patient, and what information can I pick up from that?
When you're shining better from inside, you allow people around you to shine more. You give them the power to shine more.
The body will heal the disease when there's enough health.
Incurable diseases. I've seen diabetes disappear. I've seen thyroid, Hashimoto's disappear. It is very possible. Hypertension, it can disappear if you are allowed to access an integrative approach and help the patient deal with it on every level other than simply taking away the symptom and giving them a drug to make it go away. I can't actually think of any healing space or medical space where integrative medicine is not relevant.
I call ill health signposts. They are signposts that are helping us to understand something. We are not just bodies. We are human beings on a journey. People walk into my office with a story that is not working for them. They've got a story that they are ill, that there's a disease that's incurable. And that's what I love to do, changing the story for the patient and the doctors.